Okay, guys, we're ready to start Unit 7, Joints and Joint Movements. Welcome back to the new year. Happy New Year. Second semester. Ready to jump right into it. Our learning targets for this are to be able to define what a joint is, be able to classify joints by both structure and by function, and then to describe the movements of synovial joints. Okay, so first and foremost, joints are also called articulations. We remember the word articulate means to join together. Okay, this is a little bit of a continuation of the skeletal system. All right, so let's look at the functional classifications of joints. We have immovable joints, such as sutures, and we remember that the sutures are in the skull. We remember the coronal suture, remember the sagittal suture, lambdoidal, and the temporal sutures, squamous sutures. The first one is called synarthroses. That's spelled SYNARTHROSES. Those are immovable joints. As we said, those are sutures. The next one is called amphiarthroses. That's AMPHIARTHROSES. Remember a root word, arthro, means joint. Okay, slightly movable joints, for example, epiphyseal plates, intervertebral joints, and the pubic symphysis. And we said up here those were sutures. And then finally, the last one, guys, is referred to as diarthroses. That's spelled DIARTHROSES. These would be freely movable joints. And we'll look at examples of this. Possibly would, guys, be your elbow, your knee. Both of those would be freely movable joints, diarthroses. All right, so let's look at the structural classification of joints. First one is going to be called fibrous. These are bones united by fibrous connective tissue. Sutures in the skull. You remember that the sutures in the skull start out as with a space between them. They're movable. We said that helped with vaginal deliveries. And that fibrous connective tissue was referred to in several spots as fontanelles. The next classification, guys, is cartilaginous. And made of just what it sounds like. The bone ends are connected by cartilage. Examples: epiphyseal plates, intervertebral joints, and pubic symphysis. And then finally, the last one is going to be called synovial. And in your synovial, the bone ends are separated by a fluid-containing joint cavity. These are hinge joints, such as the knee and elbow, ball and socket joints, such as the hip and shoulder. All right, we're going to move forward down here, guys, and on the next page, we're going to draw a little bit of a concept map here. All right, so we'll start with the term joints. Make my little box there. And then over here, I'm going to do functional classification. And over here, I'm going to do structural classification. Now, this is just another way, guys, of you to be able to organize this material. Some of you are more visually oriented and like things like this. Okay, so we'll start with functional classification. We had 3. The first one was synarthroses. And those would be classified as immovable sutures. Would be an example of those. All right. Then we come down and we do amphiarthroses. And these are slightly movable. And we'll make this box a little bit bigger here. And then these are slightly movable. For example, the pubic symphysis, which we will remember connects the two pubic regions of the coxal bones together. All right, and then finally the next one, guys, the final from this one is going to be diarthroses. Oops. Let me make my box pretty big on here. And these are freely movable. And example would be elbows and knees. Okay, now let's do structural classification. Over here, we'll come over here, and our first one, we're going to draw down here, is going to be fibrous. And that would be an example of this would be your sutures. And then we have the next one. We have obviously, whoops, I want to go back on this one. I'm going to do it in this color. The next one we want to do is cartilaginous. Make us a nice big box here. An example of cartilaginous, guys, is going to be such as cartilage, which would be okay, so let's see if I can, and so I'm stuck here, which would be like the pubic symphysis. All right, and so finally, the last one of those guys was synovial. And those are fluid-filled joint capsules. Well, it won't let me go to another color, so we'll just keep on doing this. Which would be a fluid-filled cavity, such as the shoulder. All right, so there is our concept map for that. All right, so the next thing we've got are some examples of these, and we'll label these to see a little bit more in detail, and we'll give an example of each one. And so we put these into categories, all right, the different categories. So we're going to start over here on the left. Our first category for this, guys, is going to be cartilaginous joints. All right, and so you can see where this location is right here, where that's located. This is called a synchondrosis. What you have is the first rib, and then you have the hyaline cartilage, and then you have the sternum. All right. The next one of these guys is called a symphysis. As you can see here and here, we have our vertebra. And we're seeing that this obviously connects to there. And you see here and here, we have our fibrocartilage. Because we remember that intervertebral discs are made of fibrocartilage. And then our final one also is a symphysis. This is your pubis. And then this is fibrocartilage. Now, all of these are cartilaginous joints, and you can see that that goes there. Now, the next one we're going to talk about are fibrous joints. They have that fibrous membrane. This would be the fibrous connective tissue here. And that would be a suture, okay? And you can connect that to there. And then below, we're going to be looking at what is known as a syndesmosis. Syndesmosis. And you can see that going there. And this is obviously the tibia. Little review there. You have the fibula. And this would be the fibrous joint, fibrous connective tissue that stabilizes these two bones together. All right, and so that brings us to our last classification, which would be synovial. All right, this first one is known as a multi-axial joint or a shoulder joint. And I'm just going to put out here multi-axial. All right, and what you have here is the scapula, which you remember is your shoulder blade. You have the articular cartilage, which is known as hyaline cartilage. That's what it's made of. And then, of course, you have this bone being the humerus, because obviously this is right there in your shoulder joint. Here you have your elbow joint, and we call this a uniaxial joint. And what you're looking at here is at the base of the humerus, at the distal end. And then you have the ulna. We know this is the radius because it looks like a nail at the top of it. And then you have this area right here is known as your articular capsule. And so you have in here, right in here, is fluid filled. Okay? So that's why we call this a synovial joint. And then finally, the last one we're looking at down here, we're looking at our carpals. And obviously these are all our carpals right here. That's known, well, you know what, I'm just not going to write that right there. We'll just write it below it. Carpals, that's our wrist. It is known as a biaxial joint. And so you again have the ulna, the radius, and then this right here is your articular capsule. All right, so moving on in our notes, let's talk a little bit about joint movements. And here we get to name or describe or perform, because that's a thing, the common joint movements. All right, so flexion. Sun's out, guns out, right, guys? Decreases the joint angle. extension increases the joint angle. Flexion decreases, extension increases. Hyperextension extends beyond 180 degrees, beyond anatomical position. Very painful. Dorsiflexion, that's going to be bending the foot upward, so you're bending the toe upwards towards the back. Dorsal flexion, decreasing the joint angle. You have plantar flexion, and in plantar flexion, you depress the foot, you point the toes towards the plantar region. Inversion, turning of the foot so that the sole faces medially. It's kind of like rolling your ankle there, turning your foot inward. And then eversion, which is turning of the foot so that the sole faces laterally. Rotation, movement of body part around an axis. So like you're saying no, you've got the atlas and the axis articulating together. You have supination. That is the rotation of the lower arm so that the palm is upward. You would be in anatomical position when you're supinated. Pronation is rotation of the lower arm. Palm is downward or facing posterior. Circumduction. Movement of the body part in a wide circle, like you want to circumnavigate the globe. This would be circumduction, moving the body part in a wide angle. Abduction. Movement of the body part away from the midline. You are taking something away. When you take something away, you kidnap it, you abduct it. So that's abduction. Adduction is movement of the body part back towards the midline. You're adding something back. Moving a body part forward is protraction. So like sticking your chin out, you know, when you were little and you were stubborn and your mom would say something, you just kind of look at her and stick your chin out like, go ahead and make me. Okay, you're moving a body part forward. That's protraction. Retraction, you want to take something back. That's moving a body part backwards. Elevation is raising a body part. And lowering a body part is depression. All right, so these are your major joint movements. And in class, you're going to work on doing an activity either Tuesday or Wednesday when you're in class that illustrates the different types of joint movements. All right, and you can see here in our next infograph here, it illustrates how you do flexion, extension, hyperextension, rotation, circumduction, abduction, adduction, extension, flexion, supination, pronation, dorsiflexion, plantar flexion, inversion, eversion. One that we missed was opposition, and you can see opposition is where you take your thumb and you touch each of your fingers. All right, so that one, guys, is going to be a bonus. Opposition is going to be a bonus. And that's where you take your thumb and you touch each of your fingers. Okay, and that's opposition. That'll be a bonus. All right, so let's talk about synovial joints. We're going to talk about the different types of synovial joints. Describe the types of synovial joints based upon their shape. Okay, the first one of these guys is going to be a plane joint, as in planes and sections. These would be example of this would be intercarpal and intertarsal joints. The next one would be a hinge joint. I think that one is self-explanatory, just like the hinge on a door. That would be an elbow joint or a knee joint, and joints between the phalanges of the fingers. That would be hinge joints. The next one, guys, is a pivot joint. You remember a pivot move in basketball is where you plant one foot and you rotate around. Examples of this would be the proximal radial ulnar joint. The first two vertebrae, atlas and axis, allows you to pivot or rotate. The next one is called a condylar joint. It is the metacarpophalangeal joints, which would be your knuckles, okay, where your metacarpals and your phalanges join together, which would be your knuckles. That is called a condylar joint. Then you have what's known as a saddle joint. Carpometacarpal joints in the thumb. And finally, you have what's known as a ball and socket joint. This is probably one that you're most familiar with when you look at your hip and your shoulder joints. Okay, shoulders and hips. All right, and so the next thing that we're going to do is we're going to label the different types of joints. All right. So the first one of these, guys, is our plane joint. Okay, and you can see how the plane moves there when we're talking about the intercarpal and intertarsal. The next thing that we're going to talk about is a hinge joint. Again, that's kind of what it says. You can see here, like this would, up here would be like a hinge. And it shows you where you can find these. Then we look at a pivot joint. Okay, and you pivots around. Followed by the condylar joint. Now, in the condylar joint, guys, you're looking at the metacarpal, and you're looking at the phalange. Okay. And then next, you have the saddle joint. And when you look at the example up there, that how that fits right here, that just looks like a saddle that you would put on something. And that's your carpal and your metacarpal number one. So that's your carpal and your first metacarpal. And then finally, you have your ball and socket joint. In this case, this is going to be our shoulder. You have the head of the humerus. And then you have right here your scapula. Okay, so in looking at this and labeling, when you're labeling this up here would be F. That would be your ball and socket joint. This would be B, your hinge joint. This would be C, pivot joint. This is a plane joint. This would be a saddle joint. This would be, we said saddle joint, so that would be E. And then finally, you would have here D, your condylar joint. So that's where you can see each one of those located. Notice that B and C, how they work together. You have the head of the, you have the humerus here, and you have your ulna and your radius. You have the same thing going here, humerus, ulna, radius. All right, and then let's talk a little bit about joint damage and some injuries. We're going to name the most common joint injuries, disorders, and discuss symptoms and problems associated with each. So our first one is going to be cartilage tears. Overstressed cartilage snaps or pops. Most common one would be the tearing of the knee meniscus. Here it tears and overuse damage to the articular cartilage of other joints. You see this in young athletes, repetitive use. The next one would be sprains. Ligaments that reinforce a joint. Remember, ligaments bind bone to bone. They're stretched or torn. Common sites are the ankle, the knee, and the lumbar regions. Now, if the ligaments are torn, you have three options. They can be sewn together. You can replace them with grafts. You'll see this with ACLs, known as your anterior cruciate ligament. In a piece of a tendon from a muscle can also be attached. Those are the types of grafts. And then finally, the next one would be time and immobilization. Surgical option would be common in the MCL, the medial cruciate ligament. All right, then another type of injury would be a dislocation. This is when the bones are forced out of alignment. Usually accompanied by sprains, you have inflammation, difficulty in moving the joint. They've got to be reduced or returned to the original position. So we say reduction is moving the ends back together. So like a dislocated shoulder would be, as you would say, popped back into place. Going on to some inflammatory and degenerative conditions. The first one we want to talk about is bursitis. That's inflammation of the bursa sac. When you have these fluid-filled sacs, you have a decrease in the fluid. You've got decreasing friction, so you'll have more friction there in the inflammation there. Symptoms, pain and swelling. Treatment, anti-inflammatory drugs into the bursa sac. Example of this would be housemaid's knee or a student's elbow, where you would see that in as an example of bursitis. Next one up is tendonitis. Inflammation of the tendon. Inflammation of the tendon sheets. Causes pain and swelling. You're going to find this in your synovial joints. Treatment, rest, ice, and again, anti-inflammatory drugs. You're going to see treatment, a lot of these would be anti-inflammatory drugs. The next one, very common, arthritis, inflammation of the joint. Notice here, guys, there are 100 different types of arthritis. It is the most widespread crippling disease in North America. 1 in 5 are affected. Symptoms, pain, stiffness, and swelling in a joint. Now, we've got different types of arthritis. The first one of these, the most common, is osteoarthritis. And remember, oste is bone. I just can't write tonight. Osteoarthritis, guys. Most common arthritis. That's wear and tear arthritis. Eventually, the articular cartilage just gets worn away after repetitive use. Next up after that, guys, is rheumatoid arthritis. This is an autoimmune disease. It is a chronic inflammatory disorder, autoimmune. can be inherited. So there's a genetic component there. And then you have what's known as gouty arthritis, gout. Excess uric acid deposited in the joints. Again, inflammation and pain. Inflammation is a common theme running through all of these. And then the next one after this, guys, is going to be Lyme disease. You're familiar with this because it is a tick-borne disease. It's caused by bacteria transmitted through the tick bite. You get joint pain, arthritis, skin rash, flu-like symptoms, foggy thinking, leading to neurological disorders, irregular heartbeat. Treatment for this, since it is bacterial, is going to be antibiotic therapy. And that is the end of your notes for joints. These are going to be due by Friday, the 8th, at 11:59 p.m. for a grade. You will use the pictures in these notes and the definitions to fill in your study guide, and your study guide is going to be due the night before your quiz. All right, guys, look forward to seeing you in class. Welcome back.